The Home Health Quality Improvement National Campaign welcomes you to Are You at Risk for a Heart Attack or a Stroke? This video is part of a series reviewing different ways you can work with your healthcare team to reduce your risk for having a heart attack or stroke. In this video, we will learn about the signs of heart attacks and strokes and what you should do if you would have any signs or symptoms. Today, we are going to check in on a patient and his wife during a home health visit. The nurse is explaining that there are certain heart attack and stroke risk factors. The nurse asks the patient if his doctor has ever talked with him about risk factors for heart attacks or strokes. She shares a list of risk factors for a heart attack and asks the patient to check off any of the risk factors that apply to him. The following are risk factors for heart attack. Do you have any of these risk factors? Age increases risk. If you are 65 and older, you are at a higher risk. Men are at a higher risk for heart attack than women. Family history also plays a part in heart disease. Certain ethnic groups are at a higher risk. African Americans are at the highest risk, followed by Mexican Americans and whites. American Indians, Native Hawaiians, and some Asian populations are also at risk. Certain medical issues increase your risk, such as high cholesterol levels, high blood pressure, and diabetes. Tobacco use and alcohol abuse are factors. Lack of exercise and being overweight puts a person at risk. A diet that is high in fat, salt, and calories increases your risk for heart attack. Do you have any of these risk factors? Just one puts you at risk, but the more risk factors you have, the higher your risk is for a heart attack. Let's talk about risk factors for strokes. Many of the risk factors for stroke are the same as those for heart attack. Do you have any of the stroke risk factors? Age is again a risk factor, and after the age of 55, your risk doubles every 10 years. Family history of a stroke puts you at risk. African Americans are the highest ethnic group at risk. Women are at a higher risk for stroke than men. This is the opposite to the incidence of heart attacks, where men are at a higher risk. Medical conditions from the neck up that increase your risk include prior stroke, TIA or mini strokes, or carotid artery disease, the arteries in your neck that supply the brain with blood. Conditions from the neck down that increase your risk include high blood pressure, diabetes, coronary artery disease, heart attack, heart failure, other heart disease, or any other artery disease. Other conditions include sickle cell disease and high cholesterol levels. Tobacco, alcohol, and drug abuse are factors. Lack of physical activity, being overweight, and poor diet are stroke risk factors. You can see that most of the risk factors for stroke are similar to heart attack risk factors. Do you have any of these risk factors for stroke? The nurse talks with the patient and his wife and explains that there are many things that can be done to reduce or eliminate certain risk factors. It is very important for you to talk with your doctor or nurse about your risk factors and to learn more about what you can do to reduce your risk. If you have any of the risk factors for heart attack or stroke, it is also very important to know the signs of both. Here is a list of the classic signs of a heart attack, but please be aware that everyone's signs may be different. If you're not sure, always seek medical attention right away. Some people complain of chest pain, heaviness, or discomfort that lasts for more than a few minutes, or goes away and comes back. It can be severe pain, like an elephant sitting on their chest, to a feeling that your chest is being squeezed together. Some people feel very little discomfort, but that feeling keeps coming back. Some people get pain or discomfort in their arms, in their back, up their jaw, or even in their stomach. Also, a person might get short of breath or have trouble catching their breath. You do not have to have chest discomfort with shortness of breath, but you might have both. Another sign of a heart attack is breaking out in a cold sweat for no reason, feeling sick to your stomach, or even feeling dizzy or lightheaded. Remember, everyone's heart attack symptoms are different. Some people have no signs or vague, unclear signs. This happens more in older adults, women, and in diabetics. If you think you might be having a heart attack but are not sure, always seek help immediately. Call 911 to get the fastest response. Make sure your friends and family know the signs of heart attack and to call 911 as soon as possible. Signs of a stroke can include one or more of these. The face droops to one side. There may be sudden numbness or weakness in one or both arms, legs, or on one side of the face. A person may seem confused or have trouble understanding. If there's sudden trouble seeing in one or both eyes, that can be a sign of a stroke as well. Difficulty walking, being unsteady on your feet, or even falling can be a sign of a stroke. Also, a severe headache with no reason or slurred speech may occur with a stroke. FAST is an easy way to remember the symptoms of a stroke and what to do about it. F is face drooping. A is arm weakness. S is speech difficulty. T is time to call 911. Call 911 as soon as possible. The earlier a person gets emergency help, the sooner treatment can be started. This may help to reduce the severity of a stroke and can even prevent death. Remember to always seek medical attention if you're having signs of a heart attack or stroke. There are definitely things that you can do to lower your risk of having a heart attack or stroke, so now is the time to start making those changes. Heart attack and stroke cut lives short each year. Think about all the family gatherings, grandchildren, or great-grandchildren that you might not get to spend time with, or the prospect of missing out on all the things you enjoy doing. Make sure that you and your family members are aware of the signs of heart attack and stroke, as well as what to do. Ask your doctor or nurse for a list of the risk factors, signs of heart attack and stroke, and what to do if you have the signs. Keep the list somewhere you'll see often, like on your refrigerator, nightstand, or next to the phone. Thank you for watching Are You at Risk for a Heart Attack or a Stroke? We hope that you've learned more about the risk factors for a heart attack or a stroke. For more information about what you can do to help reduce your risk factors, talk with your healthcare team and ask to watch other videos in this series.